What does all this mean? This means that if you remember a while back, the questions were always, so COVID's just going to become endemic. What's endemicity look like? How will we know when it's endemic rather than an epidemic? Well, I think we're in an endemic situation now. I think that largely the epidemic or the pandemic is past us, at least here in North America. There are some places, some countries that are still wrestling with it. China is playing catch up. Their zero COVID policy kept things down for a long time, but when they released it, the number of infections skyrocketed in China, and they're still dealing with the pandemic. But here in North America, I mean, we got through our respiratory viral season wave of COVID pretty well this January. Hospitalizations didn't go anywhere near what they were last year in January. Deaths didn't go up anywhere near what they were last time in January. It seems like this is what endemicity feels like. So COVID's here to stay. The virus will still be around. But for those who've been immunized, particularly those who've been boosted, they'll either avoid the infection entirely or it'll be a minor cold, just like our other colds are. So it kind of looks like the flu, right? We've been dealing with the flu for hundreds of years. And the flu comes around generally in the late fall, early winter. We have a respiratory viral season of flu, and then it goes away. And we get our flu shot in the fall to help protect us and get us through that. So I think that's what COVID's going to look like for us. Now, I don't want to diminish it. Flu is bad enough, right? Particularly for older people or people with other underlying health problems. The flu can be quite serious. In fact, we have, on a normal flu year prior to the pandemic, we would have 15 to 20,000 deaths on an average year from the flu here in the United States. So even though I say the pandemic, I think here in North America is behind us, and we've entered a period of endemicity, there will still people who get it, and there'll still be deaths, and vaccination will still be one way, and probably the best way yet to protect our vulnerable populations.